Well, what's the background for my particular case? It was not an ophthalmology case. The setting was back in 1985 when I was working in the emergency room at Hendricks Medical Center in Abilene, Texas. In those days, many physicians in the military and some of the people that were residents and in training at that time moonlighted, so to speak, in emergency rooms because there was no specialty of emergency room medicine and there was an opportunity to earn a little additional income. And I had certainly had completed an internship in general surgery and felt very comfortable in being able to manage trauma and medical problems in an emergency room setting. The time was around 11 p.m. and I was the only emergency room physician on call when a 10-year-old male came in. He had been traveling with his family from Dallas to El Paso, where his father and mother lived and where his father needed to be work on Monday. It was a Saturday night. He was accompanied by his father to the emergency room, and his mother stayed with the other children in the waiting room. His dad had to be to work on Monday, and I was well aware of that. The history was one in which the child had fallen and had pain near his left hip. My examination was essentially what you might expect. There was some lower extremity pain and tenderness, but full range of motion. The distal neurovascular system was intact. There was mild tenderness near the greater trochanter. The radiology, fortunate for me, the radiologist had read the film and reported no hip or a normal hip, femur, and all the images were essentially negative. And I also had a wet reading when I looked at the films, and that was my assessment as well. And this was confirmed in a written report by the radiologist later. In those days, CT scanning was not performed. The diagnosis, my working diagnosis, was one of a contusion of the soft tissues of the bone. I was well aware that sometimes fractures don't show up acutely and that this could be a possibility. My decision then was whether to admit the child for observation or to let the family continue on to El Paso and have the child seen on Monday. There was a strong motivation on the part of the family, and particularly the father, to get home because he needed to be at work. And I made a decision to discharge the child to the care of his father. And I instructed Dad very specifically, and I could, believe me, recall the conversation very clearly in my head, that I had instructed the dad to take the child to see the family doctor on Monday upon arrival in El Paso, and that I would allow weight bearing as tolerated. Well, what happened? Dad did not take the child in on Monday. In recollection at deposition, his statement was, as the ER doctor told me, there was no fracture. 3 months later, the child began to limp. 9 months later, the child could not bear weight. Eventually, a fracture was discovered with non-union and early joint degeneration, and the child had to have this surgically repaired. The claim, of course, when you get these claims in the mail, they make you sound like the very worst thing on the face of the earth. I mean, it is really hard to sit there and read this. They claimed that I failed to diagnose the hip fracture, that I'd failed to admit the child to the hospital, that I had failed to obtain appropriate consultation with an orthopedic surgeon that night, that I'd failed to instruct the family on follow-up care, and that I'd failed to inform the family of the consequences of the injury. Those were the allegations. Well, what were the damages? Late surgery was required. The child was going to have some arthritis in his hip at an early age. Perhaps he was going to need hip replacement at an earlier age in life, and that he might have a hindrance to his quality of life in terms of athletics and limited employment opportunities, and of course there had been some pain and suffering. The demand was for $1.5 million. And these included both medical expenses past and future loss of wages. There, of course, were pain and suffering is always an allegation.